Good afternoon. Thank you for joining us again today. I'm joined by our new Chief Nursing Officer, Amanda Croft, today, and by a more familiar face, the National Clinical Director, Jason Leitch. Both of them will help me answer questions shortly. Firstly, though, I will recap briefly on the changes that have come into force over the past few days. More substantially, I will give an update on the Scottish Government's expectations for secondary school reopening after the Easter holidays. But before any of that, I will give the usual update on statistics. I can report that the total number of positive cases yesterday was 259, which is 2% of the total number of tests carried out, and means that the overall number of confirmed cases is now 220,493. Of the new cases reported yesterday, 93 were in Greater Glasgow and Clyde, 44 in Lothian and 32 in Lanarkshire. And the remaining cases were spread across 6 other health board areas. 196 people are currently in hospital. That is 19 fewer than before the Easter weekend, which is when we last reported this figure. And 21 people are currently receiving intensive care, and that's the same number as before the Easter weekend. I'm also pleased and relieved to report that no deaths were reported yesterday, but I should point out that, as you know, yesterday being Easter Monday was a public holiday and many registration offices were therefore closed. So it may be that the no deaths being reported today is an underestimate, which we will see reflected in statistics later in the week. But the total number of deaths registered under the daily definition that we use is now 7,614. And that number, of course, reminds us of the impact that the virus has had on many families across the country and the grief that it is continuing to cause. So again, my thoughts and condolences are with everyone who has been bereaved. Let me also provide an update on the latest vaccination figures. As of 7:30 this morning, 2,577,816 people have received the first dose of the vaccine. That's an increase of 12,536 since yesterday. In addition to that, 7,406 people received their second dose of vaccine yesterday, and that brings the total number of second doses that have been administered now to 463,780. So virtually all over 60-year-olds have now received at least the first dose of the vaccine, and so too have 92% of 55 to 59-year-olds and 72% of 50 to 54-year-olds. So far, as you are aware, we have been using both the Pfizer vaccine and the Oxford AstraZeneca vaccine. I can confirm, though, that the first batch of the Moderna vaccine arrived in Scotland safely yesterday. A total of 17 million doses of this vaccine have been ordered for the UK, and of that total, Scotland will receive well over 1 million doses. It's important to stress, though, that Moderna vaccines will arrive over a period of months, not all at once, and the doses we expect to receive are already factored into our forward projections. So the arrival of this first batch doesn't mean that we are able to accelerate the vaccination programme. The speed of vaccination is already taking account of the expected Moderna supplies. Nevertheless, the fact that we now have 3 vaccines in use is clearly very welcome, and it does give us additional security of supply, which is important. The figures I've just reported demonstrate again the progress that we are making in terms of vaccination. I want to stress that we are still on course to have offered a first dose of vaccine by the middle of this month to everybody in the population who is over 50 years old, everybody who is an unpaid carer, and to all adults who have particular underlying health conditions. And that is a really important milestone, because these groups taken together, these are the initial JCVI priority groups, and taken together these groups account for well over half of the adult population in Scotland, but also 99% of COVID-related deaths. So you can see that reaching that milestone is very significant and is one of the things that will give us confidence, we hope, to further ease restrictions later on this month. We're also seeing encouraging news in relation to case numbers. After a period recently where the decline in cases had levelled off and plateaued, we had a couple of weeks where we even thought we were seeing a slight increase in cases again. Over the past 7 days, it is much easier to see the continued decline in new cases, which is good news. In total, cases have now fallen by more than 80% since early January, when of course they were at a particularly high level. The number of deaths has fallen even more sharply than that. And as you can see from the numbers I reported earlier, the number of people in hospital and intensive care is also reducing. So all of this is a really positive picture, and it gives us a lot of optimism for the period that lies ahead. That said, and as you would expect, I need to stress this point, COVID is down in Scotland. You can see that from the figures, but as we can still see here and see even more starkly in other parts of the world, COVID is not out. It is a virus that is very much still with us. Here in Scotland, we are still seeing hundreds of people every day testing positive for it, and almost all of the new cases that we are seeing reported now in Scotland are of the new variant that emerged just before Christmas. And as we know, that variant is more infectious than the variants we were dealing with earlier last year. That is indeed one reason why so many countries in Europe are currently having to tackle big increases in new cases. We're seeing some countries, France, for example, applying new lockdowns. So that's what could still happen here if we let down our guard too far or too quickly. And it's that we've got to together, collectively, be determined that we're not going to allow to happen here. And to sustain our progress, it is really important that we ease restrictions cautiously and carefully. That's why the changes that came into force over the weekend, although significant and will make a difference to many people, were nevertheless cautious changes. On Friday, the previous stay-at-home rule was replaced with guidance to stay local except for certain purposes. And as you will know, a number of other changes came into force yesterday. Contact sports are now allowed for 12 to 17-year-olds. All shops can now operate click and collect services again. Car showrooms and forecourts can reopen, so can homeware stores, garden centres, hairdressers and barbers. I hope people will enjoy making the most of these additional services, but I would ask everybody to please continue to use your common sense to protect yourselves and others. So for retail services, that means if you need an appointment for a service, make sure that you do book in advance. Don't go to places that are busy, even garden centres. If they look busy, come away, go back at a time when it might be quieter. And please follow any advice or instructions that are being given by staff, because they are working under pressure, but they are doing their very best to try to keep everybody safe. More generally, as the weather improves, I say that with a bit of a wry smile, given the weather we're experiencing right now, but as hopefully the weather will improve in the weeks to come, many of us will be able to meet up a bit more with friends out of doors, and I think it's really important that we do get the ability to take advantage of that. But again, it's really important that we take sensible precautions. Don't, for now, meet in groups of more than 4 people. For adults, that 4 people should not have any more than 2 households within it. Most people I know are following all of these rules really rigidly, and I'm hugely grateful for that. But I'm stressing this point particularly about outdoor gatherings, because we did see some scenes at the weekend, particularly on the meadows here in Edinburgh, that were of considerable concern. Police officers should not have to get involved in dispersing large groups of people. I know the restrictions remain really tough, and I know why people want to meet up in larger groups. I think we all have a desperate desire to see more of our friends and family, but the fact remains the best way for all of us to be able to do that in the hopefully near future now is to keep these case numbers as low as possible while the vaccination programme continues to gather pace. And the best way to do that for all of us is to try to take the sensible precautions and abide by all of the advice that is in place. Now, if we do continue to keep the virus under control, as I hope we will, we expect to be able to make further more significant changes on the 26th of April. I hope to confirm these changes, which would include a full reopening of retail and the first phase, quite significant first phase of the reopening of hospitality. I hope to be able to confirm that on the 20th of April. I can also confirm today that to support the further easing of restrictions, we intend to further expand the availability of routine testing. We do intend to move to a situation where lateral flow tests, which are the tests that give quicker results, will be available twice a week on a universally accessible basis. We'll set out more detail, hopefully later this week, on how tests can be accessed and from what date. This testing will be in addition to, and it will supplement, the existing testing routes that are in place in priority areas. We set those out in our updated testing strategy last month. And this more universal approach to asymptomatic testing will allow us to assess the impact that that might have on further suppressing transmission. So all of these things are positive, and it's certainly the case right now that we're on the right track and a good track in Scotland. But if we're going to stay on it, we need everybody to continue to play their part, especially since we are still determined to prioritise getting young people back to school. So let me turn now to that. I can confirm that having assessed the data with the input of our clinical advisors, that when the Easter holidays end, virtually all pupils will return to school full-time. So secondary schools after Easter will go back to in-person full-time learning. The one exception to this is children who are on the shielding list. We are continuing to recommend that they stay at home until the 26th of April, and that's in line with advice already received from the Chief Medical Officer. All other pupils, though, will return to school once the new term starts. This, I know, will be a huge relief to many children and young people, and of course to many parents and carers. And as I said a moment ago, by the end of April, we want to see children on the shielding list also get back to school in person as well. I know, though, the return to school, particularly for older pupils, will cause concern and anxiety to pupils, to parents, and of course to teachers and others who work in schools. So let me give an assurance that we will continue to give paramount consideration to safety. The return to school will involve, as it did last August, the removal, where necessary, of strict 2-metre physical distancing between pupils in secondary school, but we are asking schools to consider how they strengthen other mitigations. For example, we've committed almost £400 million of funding to help with education recovery, and I know that many councils have been using some of this funding to monitor and improve ventilation in schools. In addition, twice weekly lateral flow testing is already available for all school staff in primary, secondary and special schools, and also for all secondary school pupils. And I would encourage as many staff and pupils as possible to make use of that testing. Through these measures and others, the government, schools and local authorities will do everything possible to ensure that the return to school is as safe as possible. And of course, every day that passes now, more and more adults, and that will include more and more teachers and more people who work in schools, will be receiving the vaccine as well. We'll, of course, continue to study and assess the data in order to quickly identify and limit any outbreaks that do arise and make sure that we're also learning from them. Detailed guidance for schools was published a fortnight ago, and I know that staff have been working hard since then to prepare for this return. For now, let me thank everyone who is working to make this return to school possible. For many teachers and school staff, I know this has been the hardest year of your professional lives, and I am very grateful for the way in which you have adapted to such difficult circumstances. And I'm also very grateful to parents and carers and to young people themselves. The way everybody has responded to the challenges of homeschooling and remote learning has been exceptional, and I want to say a heartfelt thank you to everyone. Now, let me draw my remarks to a conclusion before we take questions from journalists. I mentioned earlier on that the next scheduled briefing that I will give here, given that we are in a pre-election period, will be Tuesday the 20th of April. If there are If there are any unforeseen developments, there may be a briefing before that, but the next scheduled one will be the 20th of April. At that point, I hope that if the virus is still under control, that I will confirm the further reopening that is due to take place on the 26th of April. And at that point, I hope also to give more detail of what we think will be possible in the middle of May and afterwards, to try to continue and where we can accelerate that journey back to much greater normality. But the point I want to conclude on is, as always, the point of how important it is, if we are to achieve all of this, is for all of us to continue to act in a way that keeps the virus under control. So please continue to stay local except for the certain purposes that are set out. Continue to work from home where you can. Don't meet other households in your own home. Don't go into other people's homes for now. And when you're outside, remember, for now, the maximum size, group size for adults is 4 people from 2 households. And always remember facts: face coverings, avoid busy places, clean your hands, use 2 metres distancing, and self-isolate and get tested if you have symptoms. If we continue to do all of these things, I am very optimistic that we will continue to see progress, and that will then enable us to get more and more aspects of our life back to something that feels much more normal, which I know is what everybody, including me, is very desperate to see. So thank you for bearing with me as I've gone through that update. I'm now going to move straight to questions, joined of course by Amanda and Jason, and I'll start today with Glenn Campbell from the BBC. Before I do take questions, can I just remind everybody again, because of the pre-election period, I will only answer COVID-related questions here. Any other questions will be dealt with outside of this briefing. But Glenn.
Hello, First Minister. A couple of points I was hoping Jason could help with. Does there need to be any change to the approach for the use of the AstraZeneca vaccine for the under 30s? And also, can he explain why clients in beauty salons are not able to take off their masks? My main question, though, is to you, First Minister, and that is it possible to have a system of vaccine passports that's fair? And if they're judged suitable for international travel, could they also be suitable for mass gatherings, for care home visits, for trips to the shops or the pub?
I'll hand over to Jason in a second in terms of the questions on beauty salons and the AstraZeneca vaccine. On vaccine passports, I mean, I've been giving the answer I'm about to give for the last few days, and what I think we need to do with the concept of vaccine passports or vaccine certification is not close our minds to it. We all want to get back to normal, so anything that can play a part in getting us back to normal is something we should think about very carefully. But nor should we just gloss over the practical and ethical issues that we have to think through properly. And I think if we're going to have a system of vaccine certification, then it's really important that if the public are to have confidence in that, and if there's to be buy-in and acceptance of that, then we have taken the time openly, not behind closed doors in government buildings, but openly with the public, aired all of the issues and aired some of the challenges in that. In summary, the two sort of sets of issues that we've got to think through are firstly issues relating to the efficacy of the vaccine. All of the data we've had about the impact of vaccine so far has been really positive, perhaps more positive than we would have dared hope for at the turn of the year. And that includes the data on the impact the vaccine has on the transmission of the virus. We realised very quickly, and this was anticipated, but it began to be seen very quickly in our data for deaths, that the vaccine was reducing the number of deaths in care homes and in the older population. What has been less certain is whether the vaccine stops people getting and passing on the virus, and therefore, would it still be a risk for somebody who had been vaccinated, who might nevertheless get the vaccine if they were circulating normally, pass it on to somebody who hadn't been vaccinated. Now, the data on that is positive, but there are still unanswered questions there, and that is quite significant in terms of then being able to judge just how, safe relying on vaccine certification would be. And the second basket of issues really are the ethical inequity issues. Right now, the vaccine is not approved for younger people, people under 16. So if we have a system where having a vaccine passport gets you into certain places, but if you don't have a vaccine passport, you can't get into certain places, then that raises issues of fairness for people who right now can't get vaccinated, younger people, and there will be some people who, for health reasons, are not able to get the vaccine. We need to think through all of these things safely. I think it might have been Jason that was telling me this recently. Forgive me if I'm wrong about that, but I think in Israel, where they are making use of some vaccine certification, children can't get into a restaurant. Their parents can go in, but children have got to sit outdoors. So these are things that possibly we can work our way through, but we've got to think about them, and we've got to make sure that people are comfortable. Otherwise, we could see something being counterproductive rather than helpful. So we want to have an open discussion. We are very hooked into work that's been done on a Four Nations basis and international work that is being done on this. And my last point before handing over to Jason, who may want to say more about this as well as the questions you directed to him, is that there may be a distinction between using vaccine passports for international travel versus using them for access to things domestically, because some of the issues that we have to consider might differ depending on what we're talking about. So that's a fairly long-winded way of saying we just don't know for sure yet exactly what role they will play. I'm not one of these people that says never, ever, ever, because I think we need to be open-minded to anything that helps us get back to normality, but nor am I one of these people that just says, well, just forget some of the really complex issues that we've got to think through. Let's have a grown-up debate about this and trial where that is appropriate, learn lessons as we go, but get to the right position through a mature, grown-up debate.
Thanks, First Minister. So very quickly, the only thing I would add on COVID passports is I think the use of the word passport has perhaps confused things a little bit. I think COVID certification in the round will become a thing. TV companies are already using COVID certification to allow them to film. So that already exists. That might be about testing, it might be about previous infection, and it may in the future be about vaccination. And international travel at some point is already doing that. Some airlines are insisting on it, some countries are insisting. So Israel, you have to be vaccinated to fly in. So that won't be up to us. We will have to take a view on what a certificate looks like for the Scots. Further than that, though, I think you get into really difficult territory, and it will be a judgment for politicians all over the world whether they decide what that certificate means for entertainment, for sports, for other areas. We will give advice about what that would mean, but I think that you will see that all over the world being decided by politicians quite rightly. But I'm sceptical about the vaccine bit linking into pubs and bars and restaurants. Your other two questions, very quickly, Glenn. Beauty salons. I'm not sure I'm the right person to answer about the specifics of beauty salons, but every sector, once they're open, then want guidance that allows them to do more. So places of worship want to sing. Hairdressers want to be able to cut hair without face coverings on. Beauty salons, once open, now want face... I feel their pain. I absolutely understand. But we have to put in place mitigations to allow those businesses to conduct business. And it's really, really difficult in those areas in particular where it restricts what they're allowed to do. But for now, those are the rules. I hope that in the not too distant future, each of those examples will be able to be removed, and we'll do it just as quickly as we possibly can. Your third point about the AstraZeneca vaccine, you'll know that the groups who look at this for us, the Joint Committee on Vaccination and the MHRA, are considering these data almost on a daily basis just now. The position today is that the benefits outweigh the risk at all age groups, and the vaccine programme across the UK continues at pace. We don't anticipate that changing. If it changes, then they will tell us and we will take that advice. We're monitoring it all over the world. I read Danish data this morning in a Lancet publication that compared the Danish number of blood clots with routine years of blood clots, forgive the slightly impersonal nature of that, and their numbers are not significantly different. So we do have to be careful, particularly as we move down the age groups where the benefits perhaps shift a little, but we have very clever scientists looking at that for us, and we'll let you know as soon as they change.
Matty Sutton from Border.
Thank you, First Minister. Can I just ask, given the nature of the positive data you mentioned there, is there scope for easing restrictions early, maybe bringing some of the restrictions that were supposed to be lifted in May forward to the 26th? Is that something you're considering?
So we consider this on an ongoing basis. Jason and I and Amanda have had discussions this morning about the balance of all of this, and we'll continue to look to see what we can do as quickly as possible. There is one of these, I suppose, conundrums at the heart of this, though. People understandably look at falling case numbers and falling deaths and falling hospitalisations and say, why don't you just ease up a lot more quickly? The problem is, the reason that the cases are falling is because we have these restrictions in place. So as soon as you start to ease the restrictions, you run the risk of the virus running out of control again. Now, you can't have the restrictions in place forever. It's just you've got to get the phasing and the timing of that right. If you do it too quickly, the danger is the virus will run ahead of the vaccine and we'll be back to square one. People will have heard us here last week, and there's been some media commentary about this since then, about the situation in Chile right now, which has got very good vaccination progress, but has spiralling case rates again. And possibly, I'm not an expert on the situation in Chile, but from what I've read, perhaps that is partly down to just easing restrictions a bit too quickly versus the pace of the vaccination programme. So we've just got to be really careful and get all of this as much in sync as we can in order to keep the equilibrium that we have right now. It's not a perfect science, it's not an exact science, there's a lot of judgment involved here. But what I've said all along is that if we can possibly avoid it, we don't want to have to go backwards as we ease these restrictions, as we did towards the latter part of last year. So even if we go a bit more slowly than people would like, if that means that we keep going firmly forward, then I think that is the priority. I'm going to ask Amanda if she wants to say any more just about the general importance of restrictions, just to introduce Amanda formally to everybody, our new Chief Nursing Officer who's joining us here today for the first time.
Thank you, First Minister. So to reiterate the messages that the First Minister's already said, it's really important that we continue to look at the data, and it's looking very positive at the minute, and hopefully as that data continues to look positive, we can then reduce some of the restrictions. We're really keen to do that, and I know the First Minister is very keen to do that. But I would just reiterate, as the First Minister said, the restrictions are what they are at the minute, but our aim is to continue to reduce the restrictions slowly, so that we then don't have to go backwards as we did at the end of last year.
Louise Hosey from STV.
Yes, good afternoon, First Minister. On the return of secondary school pupils, given that schools and some local authorities may be carrying out different forms of assessments, how confident can you be that pupils' grading will be consistent and accurate across the board? Also, many pupils may be concerned that with different measures in place for assessment, that this might affect their future chances, whether that's going on to employment, college, university. What reassurances can you give that this won't be the case?
Well, in terms of, I think you're asking me about the assessment for national qualifications for this year, which is obviously an issue of huge concern for pupils and for parents. And I know teachers are anxious to get this right, as we all are. The awarding of qualifications for this year will be based on teacher judgment of evidence of the attainment of each learner. So it won't be based on past results, and it won't be based on an algorithm which caused all of the problem last year. There are local and national quality assurance processes in place that are designed to ensure consistency and accuracy in applying the national standards. That model was developed by the National Qualifications Group. That includes teacher representation. And just as an example, a lot of young people have raised concerns about whether they're going to effectively have to do something that replicates a full formal exam. There is no requirement to replicate a full exam or a prelim this year. Teacher judgment is at the centre of this. The SQ is currently also consulting on draft proposals for appeals to make sure that there is another level there that is about giving assurance and ensuring fairness. So we will continue to seek to address concerns and to build the confidence of young people in particular in the system this year. None of us would choose to be in a position where we have to put in place an alternative system. It is necessary because of the inability to have exams as normal. We've learned from last year and are trying to get this as right as it is possible to do this year. The second part of your question, which is one that I and colleagues across government spend a lot of time thinking about, is how we make sure, not just in terms of education in the sort of school sense, but more broadly, how we take steps to ensure that this generation of young people don't pay a long-term price of this pandemic. Now, that is certainly in education and in access to employment. So our Young Persons Guarantee is central to this, which seeks to give a guarantee to all young people of a place at college or university, a job, a training place on a formal volunteering scheme. I don't want to see, and I'm not prepared to see, a situation similar to the one when I was growing up in different economic circumstances, but very difficult economic circumstances, where a generation is effectively just left to fend for itself. We're determined that that will not be the case. Then there are wider issues about well-being and the mental health impact on young people, which partly through our education recovery, partly through our greater investment in mental health services, and some proposals that we've already announced for summer provision to help young people get used to being together again, interacting again. There's many things that we're taking forward to try to ensure that, while I'm pretty sure every young person will always remember this year, that 5, 10, 20 years from now, they're not still bearing the legacy of it in terms of their opportunities in life. And that is possibly the most important thing for all of us to dedicate ourselves to ensuring doesn't happen. Shona Duthie from Original 106.
Thank you, First Minister. You previously said it was likely we would see more case numbers when restrictions eased. What impact has the return of school pupils and people being able to meet outside more had on the daily data? And secondly, we've had a number of asymptomatic testing facilities in operation here in the North East in recent months. How well have these centres been used?
I don't have the data in front of me right now for the usage of the centres, but all of our testing routes, and we now have quite a complicated and developed testing system, which, as I said in my opening remarks, we'll be adding to in the period ahead. Amanda may want to say a word or two in addition to me, and they're being well used. Obviously, our focus is still on saying to people, if you have symptoms, come forward and get tested and self-isolate, but the greater provision of asymptomatic testing adds a layer of assurance for people, and it's important that people take up those opportunities. In terms of the impact on data, I'll maybe get Jason to say a word or two specifically about schools. We did see, and let me stress that this is not about necessarily transmission in schools, but after schools went back in the 2 or 3 weeks after that, after they went back on a limited basis, we did have that slight uptick in cases. Now, it may not all have been about the greater interactions that come with school return, but we saw that for 2 or 3 weeks. You heard me and others talk about that in the last few weeks. It was causing a bit of concern for a couple of weeks. We now seem to have levelled off again, and cases are starting to decline. But this doesn't happen by accident. This virus will increase or decline depending on how all of us behave. So if we are coming together a bit more, not taking the precautions, it will transmit. If we all take the necessary precautions, then we will force it into decline. That's just the reality of this. And hopefully, with every day that passes, the vaccine is helping us with that, because it will be exerting its own downward pressure on case numbers as well. But I'll ask Jason to say a bit more maybe about case numbers, and then Amanda may want to say a bit more about our testing system.
So compared to last Tuesday, I'm more hopeful this Tuesday, for sure. So last Tuesday, when the First Minister and I were here, we talked about the numbers stabilising and being stubborn. Now they have begun to fall. It has been Easter weekend, so we have to be careful that behaviour hasn't changed. So over the next few days, we'll watch very carefully to see if people who maybe put off a test are now going for a test. That not being true, then the numbers are good and continuing to fall. Schools going back does create opportunity for the virus to spread. We've never hid from that, but mitigations in place, people behaving, adults particularly controlling the way they behave around schools and stopping the kids meeting in other places, that all seems to have gone relatively well. And that's why we were able to give the advice we've given, which the First Minister has confirmed she and the Cabinet have accepted, that schools can now go back full time. Again, though, we will look at that carefully. Every time we move, the opportunity for the virus goes up. There are still thousands of people with this virus today. Even though there's 200 and something cases, remember that hides people who are asymptomatic around the country who are still a risk. So the risk has not gone away. The couple of weeks leading into the Easter break will have helped us, and now, hopefully, when schools go back, that number won't rise.
Amanda.
I think what I'll add about the testing is that we've got really good capacity now within NHS Scotland and within our UK laboratories. And the thing that testing is really good to do is it really starts to interrupt the transmission as we find more people positive, but also it allows us to identify those new variants so that we can deal with them more quickly and identify where the outbreaks and clusters are. So our testing capacity is really good. It allows us to interrupt transmission, and it also allows us to identify those new variants quite quickly.
Callum Clark from Bauer.
Good afternoon, First Minister. Just a question on Euro 2021, if I may. UEFA's deadline for cities submitting their plans for fans in stadiums is tomorrow. What are Scotland's proposals for how many fans could be in stadiums for Euro 2021, that is? And just a quick question, if I may, on your lateral flow testing announcement, the twice weekly announcement you made there. Boris Johnson, of course, made his announcement on the plans yesterday, and I know we hear the importance of a four nations approach during COVID-related issues. I was just wondering if his announcement at all sped up your plans on wider testing or even changed your thinking for Scotland.
On the first part of your question, I'm not able to get into that right now. We have to put our proposals into UEFA. They have to then assess those, and it will be for them to set out the proposals in due course. But we are well aware of the deadline tomorrow, and I am well, these are not final decisions for us. I am optimistic that we will have matches played here in Scotland with a number of spectators, a reasonably good number of spectators in Hampden for them. But obviously these are discussions and deliberations and decisions that have to be made by the appropriate authorities. We've been considering and taking decisions in terms of the progressive expansion of testing. That is based on a number of things, but two things in particular. Firstly, availability of tests, because we don't have an infinite supply of lateral flow tests. So as we get access to more of those, that opens up more possibilities. But then the other considerations are, how we prioritise the stocks that we have. So we look to and have looked to prioritise schools, for example, frontline health workers, communities with stubborn high rates of prevalence, and some workplaces in the food processing and distribution centre, for example, where we have had a propensity for outbreaks. So as the supply of lateral flow devices grows, we are able to expand more, and what is enabling us to take this decision is greater confidence that we will have the stocks to meet that demand. And we'll have to assess that. I heard yesterday some voices being sceptical about universal access to lateral flow devices. So, there are arguments for and against all of this, but I think we've got to use every tool at our disposal to the maximum, and that's what we're seeking to do here. But we've equally got to assess what impact that every intervention that we make has, and we'll set out more detail on the ways in which people can access and from when they can access these twice weekly lateral flow devices, hopefully later this week. Jack Foster from Global.
Good afternoon, First Minister. I know you've just touched on it there, but the twice-weekly testing that's going to become available on a universal basis, just wondering what sort of advice there'll be in terms of the usage of that. Are we being encouraged to test regularly, all of us, which presumably would impact on availability, or should it be connected to symptoms or prioritised to high-risk groups, for example? I mean, I know that ideally it would be available for everyone, but presumably there will be issues at the start where it would need to be prioritised, or indeed are we all being encouraged? And also, if I could just ask, perhaps I'm being optimistic here, but will the availability of over 1 million doses of the Moderna vaccine, will that bring the end of the vaccination period, the point at which everyone in Scotland could potentially be vaccinated, closer, or has that already been modelled in?
I addressed that very directly in my opening remarks. You may not have been on the call by that point, Jack, but no, the expected supply of Moderna is already factored in. We haven't just found out that we're going to get over the piece, it will be more than 1 million doses of Moderna. We've always known that, so that is factored into our projections for what we think we can do and by when in terms of vaccination. So it doesn't in and of itself increase the or bring forward the date by which we will vaccinate everybody. Obviously, supplies are still a bit volatile, so expected supplies sometimes can be greater than the actual supplies we get, and sometimes we can get supplies quicker than we thought, and we adapt our programme accordingly. But the Moderna supplies are factored into the estimates that we've already made. By the middle of this month, all of the JCVI priority groups, that's groups 1 to 9, everybody over 50, etc., will have been done. Our current expectation is that we will offer the first dose of the vaccine to all adults by the end of July. Of course, we will bring that forward if supplies allow, but that's the estimate we've made at the moment, and we think we're on track to be able to meet that. I'm not going to say much more on the lateral flow devices. We will set out more detail of this later in the week. We already make lateral flow devices available for certain priority groups in the population. That's not going to change. It's really important. I spoke about schools earlier. It's already the case that if you work in a school or if you're a secondary school pupil, you can access twice-weekly lateral flow devices as schools go back after Easter. It's really important that we put an emphasis on uptake of those. There is access to testing in some other workplaces and obviously across the National Health Service. What I've set out today is an addition to this, which will be anybody in the population can access lateral flow testing twice a week if they want it. So you don't have to be symptomatic. In fact, this is about trying to pick up more asymptomatic cases. And again, it's just about extending the reach of testing to see what impact that has on just driving down transmission. As I've said many times before, and we've all said many times before, and I will say ad nauseum as we extend testing, testing is not a substitute for sticking to all the rules, because you might test yourself one day and be negative. You could still be incubating the virus and it doesn't show up in the test, or you could test negative, go out your front door and meet somebody that passes the virus to you. So it doesn't mean that you can throw caution to the wind and just live completely normally. It's got a big part to play, but it's really important that we don't talk about testing in a way that encourages people to stop taking all of the other precautions, but we'll set out more detail later in the week. Brian Swanson from Sky Sports.
Good afternoon, First Minister. Just to follow on the question there about the European Championships, what will you be saying to supporters? What's that fan experience going to be like? Have you ruled out any form of vaccine passports? And just to be clear, have UEFA given the Scottish Government a specific minimum capacity of supporters that need to be at Hampden in June for those games to go ahead?
Look, we have a deadline to make a proposal to UEFA tomorrow. I'm not going to get into that just now. It's important that we have that proper discussion within the proper processes that have been set there. I am, and I've said this before, and I know I'm not alone here. There are many people who will feel it even more strongly than I do. I desperately want to have these matches played here in Scotland at Hampden, not least because we'll have the ability to cheer on Scotland in a couple of those matches. So it's really important for sporting fans, but also just the idea that will be possible come June I think gives us all a lift and a belief that things might be getting back to normal. The whole issue of vaccine passport certification, I think we've gone into some of the issues with that earlier on. I'm not going to go back over these issues. I think we will see some kind of vaccine certification starting to be used. Other organisations will ask for it, but we have some issues to think through in order to give assurance to the public. And of course, in terms of the European Championships, there are other countries involved in this, and some of those countries have real challenges on their hands with COVID right now. So there are some tough issues in there for all of us to continue to grapple with. But I hope I can't, we're still in a global pandemic. I can't stand here in early April and give absolute 100% guarantees for June on anything, really. That's not the nature of what we're dealing with. But I am very, very hopeful. I'm hopeful that I might be at Hampden to cheer on Scotland in the European Championships, and we'll continue to work as hard as we can to make that happen. Tom Eden from PA.
Hi, thank you very much. Good afternoon to you all. Can you hear me? Sorry. Based on the A&E waiting times published this morning, the number of patients attending in January and February this year have fallen quite drastically, but the proportion who have had to wait 4 or more hours was higher than at any point during the pandemic. Probably for the Chief Nursing Officer and for Jason, I was just wondering if you know why this could be. Is it a case of those frontline staff being completely knackered after so long during this pandemic, or what the reason is? And for you, First Minister, the Scottish Hospitality Group has raised concerns today about the Strategic Framework Business Fund stopping on the 19th of April. They say that only about a quarter, maybe less, of pubs have outdoor space to reopen from the 26th. So can you explain why this support is being pulled before venues are able to reopen? What advice or support could you offer to venues who have to remain closed for even longer?
I've not seen exactly what the Scottish Hospitality Group have said, but if it is as you have set out to me there, it's a complete mischaracterisation of the position. We're not pulling support. We are, and I set this out in Parliament when I set out the latest iteration of our route map, and we're doing this in response to business requests, actually. The payment that businesses will get later this month will be a combination of a final instalment of the grant support for being closed, and this is the bit that businesses asked us to do, and that will be combined with a start-up grant that will help businesses over the next period with support for getting their businesses back up and running. So for hospitality businesses, that will be a grant payment at the end of this month of up to, I think, £19,500, which is actually more generous than if we just continued the closure support that had been in place, which is what we had intended to do. But we changed this in response to specific requests from the business community. To say that support is being pulled is just a mischaracterisation, a pretty fundamental mischaracterisation of the position. It is not the case. We're combining closure support in the final phase with substantial support for businesses to start up again. And I think it is more generous, actually, than in other parts of the UK, although on that bit I'll stand to be corrected if there are aspects of support there that I don't fully understand. And just finally on opening, so we hope, as things stand just now, that outdoor hospitality will open on the 26th of April. Pretty much, although there'll still be mitigations in place like table service and such like distancing, but as close to normal as possible. And also on the 26th of April, data permitting, we will have some limited reopening indoors of hospitality. Now, as things stand just now, as I understand it, indoor hospitality in England won't open even on a limited basis until the middle of May. So actually, we may see some return of indoor hospitality in Scotland before we will certainly in England. So we're trying to get this balance right, but it's not a straightforward thing. We know from our experience last year that if we don't get this balance right, then what happens is that we have to go backwards because the virus takes over again. And that's why the speed and the caution and the care behind these decisions is so hugely important. Now, I'll hand over to Jason, and then if she wants to add anything, Amanda, on this A&E waiting times.
Yeah, so January, February is always a bit of a perfect storm for A&E staff and patients and families. So two things combined: winter, the normal January, February numbers, but also, lest you forget, a second wave of COVID-19, which causes challenges both at the front door, but also downstream inside the hospital, inside the wards, where we've had to have beds available for COVID-19 patients, and hundreds of them during that period. It's easy to forget that in April when the numbers are going in the right direction. Actually, A&E staff have performed heroically during that period. The teams that have put themselves in that front line have done very, very well during that period. They are tired, but I wouldn't describe that as the reason for some of these long waits. We always have, even though the numbers may be low, the serious illness still comes. And that's why the numbers can sometimes look a little bit like they've looked in January and February.
Do you want to add anything?
Probably just to add to that, in terms of still in our hospitals, the infection prevention control methods that we have to use, so the cleaning of equipment, the cleaning of beds, the PPE that staff have to wear, that all takes longer than pre-COVID. So just bear that in mind. So instead of staff being able to go from one patient to another, they have to bear in mind that they need to wash their hands more, wear their PPE, and obviously the cleaning element. But as Jason says, the staff have been fantastic, and I'll take this opportunity to say thank you to the staff, not just the clinical staff, but the support staff as well. So there's a lot of things that are different now to pre-COVID that all take up time, and that means that patients, unfortunately, sometimes get seen a little bit slower.
Thank you, and I'd echo that thanks to staff. And just finally on that point, our increasing focus now is on remobilising and recovering the NHS to start to bring down the waiting times and the backlogs that have been created by COVID. And obviously we get more ability to do that, the lower case numbers are, so the fewer people that are in hospital or in intensive care because of COVID. Right, I've got 6 questions still to get through today, so we will try to make some brisk progress. But next is Michael. That was a comment directed at myself, not at you, Jason. Michael Blackley, Daily Mail.
Hi, thank you. Good afternoon, First Minister. Can I clarify on your previous answers? You seem to be signalling that there's really little chance that the May 17th restrictions will be brought forward to April 26th. Is that the case, a wholesale bringing forward of those? And also it is now, I know that you've never given a possible date for all restrictions being lifted. The date that Boris Johnson gave is now less than 10 weeks away, June 21st. Should people have any optimism whatsoever that might be possible in Scotland? Thank you.
Look, I'll continue to do what I've done, which is stand here and give people frank assessments as we're able to give them. It's for Boris Johnson to explain where the 21st of June comes from. I hope, and I've said this before, I hope that by the time we're into the summer there'll be significantly more normality and on a whole host of things. But for me to stand here right now and give certainty about that, given all of the uncertainties and unpredictabilities of this, I don't think I'd be treating people fairly. So I'll continue to try to set things out on a firm basis when I'm able to do that. And in terms of your first question, I think you were just trying to read far too much into what I said and didn't say there. I'm not able to say right now whether things planned for the 17th of May might be brought forward, so I'm not going to speculate on that at this stage. I'll give another briefing here, barring anything that brings us forward on the 20th of April. And by that point, I hope to be able to give more certainty. I hope to be able to confirm the 26th of April, set out whether there's anything we might be able to accelerate, and give more certainty on what will happen in mid-May. Christine Lavelle from The Sun.
Thank you. It was just on the vaccine rollout. The figures for yesterday show that less than 20,000 combined first and second doses were administered. I know that you previously outlined that this dip was expected because of supplies, but when can we expect to see the programme starting to pick back up pace?
We've lost you. Sorry, I can't hear you anymore. I heard the first part of your question.
Sorry, can you hear me now?
Yep.
Sorry, I don't know what's it. It was just my Wi-Fi in my flat. Sorry.
Okay.
No, my question. It was on vaccine rollout. The figures for yesterday show that less than.
Yeah, I got that bit. It was the next bit I didn't get.
Okay. Okay. Well, it was just that you previously outlined that the dip was expected because of supplies, but I just wondered, when can we expect to see the programme starting to pick up pace again?
The programme will pick up pace as soon as supplies pick up pace. We go as fast as the supplies let us, but I don't want, in the sort of subtext of that question, we should not in any sense get the impression that the vaccine programme is going slower than we expected it to. We are absolutely on track to meet all of the targets that we had set. So the phasing of this has to fit with the supplies that we have. Obviously, we can't vaccinate people with supplies we don't have, but we are on track for the mid-April target, and we are on track for the end of July target to complete first doses, offering first doses to everybody in the adult population. But the day-to-day phasing of that just depends on the overall supplies, but also increasingly on the balance of whatever supplies we've got that we have to dedicate to second doses versus first doses. And that is a daily modelling exercise that we've got lots of people working on to make sure that we meet we meet demand with supply on a daily basis. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. You said in February it was highly unlikely that sort of non-essential overseas travel would be allowed this summer. I just wonder whether that's still the case, or whether there's been any change in your thinking there. And also maybe more one for Jason. But there's obviously been a lot of promising stats around case numbers, but the R rate is still between 0.8 and 1. I just wonder why you think that's remained so sort of stubborn. And given what we know about the R number, given it's so close to 1, isn't it inevitable that as restrictions ease, it's just going to go above 1 and we're going to see a rapid rise again? Thanks.
I feel in some of this we've gone right back to summer, autumn last year when, which is not a criticism of anybody, we all have to refresh our memories of some of the answers back then. As case numbers fall, actually R becomes less sensitive, I guess. It's not unimportant, but less important. So, that's part of the explanation, but I'll let Jason put it in a bit more of an expert language. On the first part of your question, look, I've got nothing at the moment to say that advances the position on international travel. I think one of the prices we're going to have to pay for a bit of time to get more normality back domestically is in not travelling overseas. Now, I appreciate very much that that's not just about holidays. It's very difficult for people who have family overseas, and therefore we don't want that restriction to be in place for any longer than necessary. But that is perhaps one of the things that is necessary for us to get domestic normality or something approaching it back. And that's particularly the case when you look around Europe right now. Things in many parts of Europe are going in the wrong direction again. So that would say to me that the caution on international travel is actually more important, not less important. So we continue to monitor it as we monitor every aspect of this.
Yeah, so I agree on international travel, particularly the risk of variants. We don't know where that next variant's going to come from. Remember, variants are more likely in high prevalence areas. So if you're going to get one, it might be French, for example. It will be from somewhere where the prevalence is probably high. R is less important as incidence falls, because remember what the R is. It's the number of people infected by one other individual. So an R rate acting on 100 cases is very different from an R rate acting on 1,000 cases. So as you drive incidence down, although R is still something we should think about, and exponential growth from 100 is still possible, it's less likely than if you have 1,000 cases going around the country. Remember though, R with no restrictions for COVID-19 is about 3.5. We're not even really sure what it is for the new variant because no country has had the new variant wild. So as we open, we have to keep that under supervision, because if we just allow it to completely go free tomorrow, then we will get exponential growth. And that's why you've heard us say that all of these slow, gradual, data-driven changes.
Helen McCardle from the Herald.
Afternoon, First Minister. I just wanted to pick up again on the point about the MHRA is looking at the AstraZeneca for younger age groups, and I just wondered if they do reach a decision not to recommend it anymore for the younger age groups, would that then have an impact on the pace of the rollout among the under 50 age group? And do we have any contingency plan if that does happen? Thanks.
Well, I think self-evidently, if we're suddenly told we can't use a vaccine for a section of the population, it would have an impact on the pace of our rollout. So, but I don't think it's helpful to speculate beyond that, because we don't know that the MHRA is going to say that, and we don't know if they were to say something, exactly what that would be. So we need to carry on as we are doing right now, because that's on the basis of all of the safety advice we've got. And if that advice changes, then obviously we have to adapt accordingly. And at that point, we would set out what the implications would be. But I don't think it's helpful to anybody to speculate beyond what it is we know right now. Elsa Mashman from the Scotsman.
Thanks, First Minister. Just on the vaccine rollout as well, in light of what you said about vaccine passports and children in Israel, you've mentioned vaccines for under 18s in Scotland before. Is that something that's set to happen just pending kind of regulators' approval, or is it still in discussion and under consideration? And I also wanted to ask about supply. We heard this morning quite good results from the Valneva vaccine in phase 1 and 2 clinical trials. Given that we're expected to receive, I think it's over 8 million doses of that vaccine, do you have any more idea of who that might be given to? Is it still considered a backup in case something goes wrong with other vaccines, or are you already looking at a second round of vaccination?
I just may be able to say more. So we are already considering future iterations and future rounds of vaccination as we work hard to complete this one. No final decisions have been taken on that, of boosters or regular vaccination, but all of these issues are obviously under ongoing review and consideration. In terms of the first part of your question, the vaccine manufacturers are doing, I understand, trials with people in the younger age groups. Certainly the discussions I've had with Pfizer and AstraZeneca have been at this stage relatively positive and optimistic that at some point in the not too distant future the prospect of vaccinating younger people would certainly be a bright one, but we are not there yet, and I couldn't say with certainty what the time frame of that would be, because they have to do the trials, the regulators then have to look at the results and decide whether or not they're going to give approval, and what the timeline of that is, I couldn't say with certainty at this stage.
That's basically it. So both of the questions, although different, the one about children's vaccines and the one about the Valneva vaccine, neither are through clinical trials. So both have to go through phased clinical trials, both children for the vaccines we already have and Valneva, which will be a new vaccine for the world. They have to go through trials, then they have to go through regulatory approval, and then the Joint Committee on Vaccination has to decide for the UK how to use them. So do we start with 12-year-olds and upwards, or do we start from 17-year-olds and downwards, for example? I think most mainstream science suggests we will end up with paediatric vaccination for COVID-19. I think it will be the autumn at the earliest.
Thanks. And last question today, Mark McLaughlin from The Times.
Good afternoon. Technical question for Jason on Chile. It's been mentioned a couple of times this week. So Chile's got 3 times the number of, or had 3 times the number of cases as Scotland in March, but roughly the same amount of deaths, about 3 per 100,000 per week, which is low by WHO standards. They're also using the less effective Sinovac vaccine. So does this not give Scotland more headroom to open up if Chile had all of these cases, but very, very little consequence? And a question for you, First Minister, on teaching. You mentioned the teacher judgment. If you were at school, would you be annoyed if you got lower marks because your teacher judged that you had to be assessed by a test, but your friend in another school got straight A's without having to sit a test at all?
I trust teacher judgment, and for teachers, however teachers decide within the guidance and within the arrangements that have been carefully considered to make that assessment. And I think many pupils, most pupils, I think, have a great confidence in their teacher judgment as well. I'm going to hand over to Jason on your Chile point. It felt to me like a gross oversimplification of things, and trying to, we use other countries, examples of other countries, so I'm not criticising anybody from doing that, but you also have to, be cautious about not drawing, very firm parallels in the way that I think you did. But Jason might... I was going to
say roughly the same thing. So Chile is interesting, but it's not a direct shadow of what we're doing. We're not this much behind Chile or this much before. One of the things that Chile is a warning about is high vaccination rates can still lead to case increasing. I don't know this for sure, Mark. We'd have to check. I imagine the link between cases and deaths is maybe not as accurate there as it is here. That would be true in much of the world. Remember, we monitor and register every single death with COVID mentioned anywhere on a death certificate. That's quite unusual. Most countries don't do that. Now, forgive me if Chile do that. I'd be surprised if they do. So therefore, the case rate versus the death rate is maybe not the best way of looking at it. I'd rather look at their excess mortality over a prolonged period, age adjusted, to see how they've actually had COVID and what the reaction has been to COVID. And I haven't looked at that.
Okay, thank you very much. Thanks to all the journalists for joining us today. My thanks to Anna for our interpretation, and to Jason, and particularly to Amanda for her first time here for a briefing. And thanks to all of you for joining us. Things do seem a lot more positive. Things are a lot more positive right now, but we got them to this stage through a lot of sacrifice and a lot of hard work on the part of all of you, and of course, huge thanks to the hard work of the vaccination teams across the country. If we're going to keep them in a good space and keep things moving in the right direction, we just have to stick with it and make sure we're taking all of the sensible precautions and abiding by all of the sensible advice. And if we do that, hopefully in 2 weeks' time, I'll be standing here confirming the changes for the 26th of April. By then, children will be back in school and will have taken another significant step further, and things will hopefully be feeling even more spring-like than they are right now. But please stick with it, and my thanks to everybody for doing all of that. As I said earlier, barring unforeseen developments, I will see you here on the 20th of April. But for now, thanks very much.